What does it mean to partner with patients? To find out, Maine Quality Counts visited practices across the state to hear the stories of patients and providers who've forged successful partnerships. In Caribou, we met Florence Corbin and her care team, Dr. Carl Flynn, care manager Sheila Karen, and clinical social worker Joan Wright.
My husband passed away. It was very difficult for me. I was married 57 years and I missed him, and I was crying the night, and I thought, I can't cry the rest of my life.
We had tried a couple of different medications to see if we could help her ease through this, and they just weren't working for one reason or another.
One morning I got up and I thought to myself, I need help. I can't do it alone. I called Sheila, and she and Dr. Flynn helped me to get Miss Joan to help me, and she did help me tremendously.
I paid a lot of attention to what she was saying. I listened to her.
And I just saw her not too many times, and I was all right. Thanks to this lady and my Dr. Flynn. I've had him since he's moved here.
And it helps knowing patients. After her husband passed, you know, a lot of the symptoms that she may have been having initially may have been psychological in nature because she was stressed. But someone not knowing Florence, and she presented with abdominal pain, you know, all of a sudden she has a CAT scan, an ultrasound, an MRI, and a whole bunch of blood work. Whereas if I see her as someone who knows her situation, asking a couple of questions, then all of a sudden the floodgates open and you realize what the real problem is.
I have this group that I depend on highly because they've been good to me. They are good to me, all three of them.
My patients that are being managed by Sheila and Alma and, you know, the other people in the office that manage them in different ways, that my readmission rates definitely for my patients are down. You know, it wasn't that long ago that I would go to the hospital each morning, have 6 or 7 people in the hospital, and, you know, now it's down to 1 or 2 that I have in the hospital. And I think a lot of it has to do with how we manage them now, and don't just manage their diseases, but we manage them as people.
Moving on to Farmington, we met Shirley Bran, who, like Florence Corbin, is enjoying positive health outcomes thanks to a provider who knows her very well and uses a team approach.
How long have you been coming here?
30 years. And we've stuck together.
And everybody in the office not only knows Shirley very well, but I venture to say loves you deeply.
Thank you.
You know, it's not all peaches and cream. There's a lot of hard stuff going on for you right now.
Right. I had a heart attack, and I had 4-way bypass. And after that, I had a problem getting the breathing back. So I ended up in the ER a few times. Yeah. One doctor came in and said, "Do you realize how many times you've been in the ER?" The doctor told me 15 times.
So you went 15 times in 1 month.
Right.
To help during this difficult time, Dr. Bean and his staff referred Shirley to a community care team that provides support for high-risk and high-cost patients. Care team member Angela Richards set up telehealth vital sign monitoring, made multiple home visits, and accompanied Shirley to her first swimming class, an activity that Shirley now enjoys 3 times per week.
It's really been really good for her. We've seen her blood pressure and her pulse come down dramatically since being in the program. Her weight has come down. She's done really well.
Since you've been working together, how many times have you been to the ED or the ER?
I haven't.
She's been healthy. She's been out of the hospital for a long time. She's got this exercise program going on, and you just look great.
I think it's worth everything to see her walk in with a smile.
Yeah.
It's worth everything.
We caught up with patient Belinda at her office in Augusta. Belinda had struggled with uncontrolled diabetes until 6 months ago, when she took the advice of her primary care provider, Dr. Jessica House, and underwent bariatric surgery. Belinda's main point of contact at Dr. House's practice is care manager Debbie Grover.
I have to play an active part. I have to be responsible for myself because as much as Dr. House knows about medicine, Debbie knows about nursing, it's my body. I know what I feel and how I feel.
She's kind of a perfect example of, accountability and self-management. She's really an example of what we'd like more of our patients to be like in terms of their own health care. It's their health. It's not my health. I like them to look at me as a consultant. I'm literally their employee. They're paying me to advise them about healthcare matters, and I can give them some idea of how to control their chronic illness better.
I'm being held accountable to not only Dr. House, but Debbie, because I have to tell her, I have to read my blood glucose reading to her. And even on days when I don't feel like going for my walks, I don't feel like poking my fingers or stabbing myself with a needle, I do it.
I think that the patients know that you really do care, that you're working together with their provider, and really working at improving their quality of life.
This climate that we're practicing in is difficult, to achieve efficiency and quality care. And I mean, if they have access to a case manager, that's one excellent way to be able to do it. And it's such a huge, huge value to the system for you to be able to do that for my folks. I appreciate it so much, and I know they do.
Someone cares about me, and I'm so motivated that, wow, these are strangers who just walked into my life and take an interest in me. I'm going to do well.